Welcome to Ask a Puppy Trainer Show. This is where we answer all of your questions about puppyhood. I'm Bethany.
And I'm Sparky from the Puppy Academy. We're excited you're here. And now, let's get to the show. Hi everyone, welcome! Welcome to our episode 2 of our brand new special segment, Ask a Vet Show. This is our way to provide you guys with more puppy health advice to help you guys raise a happy, healthy puppy. And we're going to kick it off with our special guest, Dr. Jill Child, tongue twister already, from Plaza Del Amo Animal Hospital in Torrance, California. We're going to be diving into a couple of my favorite topics, your puppy's teeth. We're also going to go over different preventative dental health habits for your puppy to keep them on a good track. And I have a few questions to start with, and then we actually are going to open up the field to you guys so you can drop all your questions in the chat below. I'm talking really fast, sorry. I'm a little bit nervous, guys. This is exciting, though. But yeah, we are going to go over a couple questions that we've already planned. We kind of put together a lot of questions that we feel the majority of people usually ask us here at the school, but we are going to open up. So if you do have a question, throw it in the chat below, and we'll get to you guys soon. Let's get started with the show. So a couple fun questions for us to go over. First of all, though, welcome, Dr. Child. Do you want to tell us a little bit about your practice?
Thank you. Yes. So Plaza Del Amo Animal Hospital in Torrance. We are a 5 veterinarian practice. We're general practitioners, but myself, I do a lot of specializing in surgery and advanced dentistry. So dentistry is one of my passions, and I definitely love talking about it, especially preventative dentistry, because we want to make sure that all the dogs keep their teeth healthy for their entire life. That's my goal for all my patients.
I feel like that's something a lot of people don't even consider, is how much goes in your dog's teeth at the earlier stages.
Absolutely. Yep.
All right, that kind of pulls us to our first question. Why is dental health so important for puppies?
Yes, so we really want to set up healthy habits so that we're starting young when they are more trainable, as you guys know, and are more open to new things that we're doing. So we do a lot of setting them up for the healthy habits while they're young and establishing the things that we can do throughout their whole life to keep them with healthy habits with their teeth.
Very good, very good. And that brings us to our next one. When do puppy parents start this?
Yes.
Do they start young? How often should they do it? That's a question we get all the time.
Yep, and that's a really good question. And basically, as soon as you get the new puppy and you're able to start working on even just the basics of getting them used to new things is a good time to get them used to the dental habits that we want to get them used to. Okay. Specifically brushing, and we can go into that in detail now, or if you've got more questions about how to do that.
I got more questions, but I'm curious about the brushing. I actually have a question that I'll ask specifically about that. Are there any specific breeds that need more care in the beginning? They need more specific work? I mean, I think like bulldogs, they have a smaller mouth. Like, I don't really know what I'm talking about though. What breeds do you think?
So that's an excellent question. And yes, absolutely. There are certain breeds that are very much more prone to certain diseases. So we want to make sure that we're doing the preventative care for those diseases. So any of the brachycephalic breeds, so that's going to be your French bulldogs, your bulldogs, anybody with a squished face, they are more prone to... Basically, their teeth don't meet properly because, as you've noticed, their faces are a little bit abnormal.
A little smushy smush.
Yes. So their teeth don't meet properly, so we want to make sure that we're doing more aggressive cleaning on all sides of their teeth. And also, they're prone to growing extra gingiva, so you want to check and watch for that. So
What's
that's
gingiva?
That's the pink part of the gums that's around the teeth. That's called the gingiva. Okay. And it overgrows in those breeds. It's genetically linked, not anything that anybody's doing wrong or anything like that, but we do see that, and we want pet parents to really keep an eye on that. And as soon as they do see that, and especially if they see that there's getting food stuck down in there, we need to address that early.
That is actually something that my wife and I have personal experience with. One of our dogs, Ladybug, has to have them lasered off, if I'm thinking correctly, and then also have the food cleaned out. So
absolutely,
that strikes home for me.
Yep, and then for other breeds, so we're seeing a lot of the doodles, as you guys know, lots of different types of doodles, and with poodles specifically, so the poodle portion of the doodles, They tend to have a bit more of a narrow bite, which means that their canines sit a little bit closer together rather than further out on the mouth. And with that, we actually keep a close eye on them when they're puppies to make sure that the canines are coming in properly in the right area. There's some of them that their bite is too narrow and the canines are actually affecting their hard palate, which is the hard part that sits right behind your teeth.
Would that affect them during like teething? Would it hurt a little bit more than other dogs would?
It hurts a lot when they're teething and can actually affect how they continue to develop. So we tend to watch that specifically as veterinarians when they're coming in for their puppy visits. We try to keep an eye on how that's going so that we see as those adult teeth start to slowly come in and as their jaw is growing if we're having problems there.
Okay. I've actually heard a lot of that from doodles specifically. I guess that's because the poodle.
Yep, the poodle portion of it. And then we've got one
go.
one other breed. Dachshunds specifically tend to have issues with the inside of their upper canines. So it's the one and only breed that has that problem.
Do they get two that come in?
Sometimes you get the baby teeth that are still there. That's a kind of a separate problem, but they don't have thick enough bone on the inside of those upper canines. And we can end up with problems called an oral nasal fistula as they get older, which basically means that we have periodontal disease that goes from the mouth up into the nose. So we have to be really careful with making sure that we're addressing any tartar that they're getting on those canines and checking up inside those upper canines.
I can almost guarantee almost no one has heard that before because I have never heard that. I've worked with so many dachshunds, so that is awesome. That is definitely something I've never heard before, and I guarantee you so many people just pulled value from that. What about different chew toys, different like dental chews? Is there a role that plays in?
Let's definitely talk about dental chew toys and things of that nature. So one of the main issues that I see with my patients, dogs, specifically large dogs, is people think that because they like to chew on things, we need to give them things that are really hard to chew on. That is not true.
Are you thinking like, what are the...
Antlers, real
yak
bones.
Milk? What about the yak milk? I hear about that all the time.
So it depends on the product. So basically I always tell people a good rule of thumb for how you're going to buy chew toys for your dogs, puppies and moving up into adulthood, is if you can squish it a little bit with your fingers, it's safe to use.
I love that. That's awesome.
If you can't squish it, throw it out. It can break a tooth.
Wow. What about like Nylabone? They have that little puppy pack that everyone gets.
So Nylabone has variety. Some of them are too hard. Some of them are that hard plastic that are a problem.
The white
Some
one,
of them have give. I'm that crazy person that walks into a pet store and squishes every single toy as I walk down the aisle.
I would do the same thing. We both would. Probably her more than me, though. All right. Now, this is probably one of my biggest ones. How often should a puppy have professional checkups or cleaning done on their teeth? Because I could say that I've gone to my vet for years, and when she turned 3, that's when it like magically appeared as this is the next thing you should start doing. Do you think they need it younger than that?
Depends on the breed. So it is very breed specific. Larger breeds, we don't see nearly the dental problems that we do with smaller breeds. Smaller breeds, most of them we have to start their professional cleanings under anesthesia between 2 and 3 years old. The larger breeds, most of them 4 to 5. There's some of them that we can even go later than that. Some of them that have a much more normal set to their faces. They just don't get the periodontal problems.
So does it come from the nose being so short for smaller breed dogs that...
No. So the small breed dogs, where we see the issue is periodontal disease basically happens when you get bacteria between the gums and the tooth. And they have such a thin amount of bone that's there that it doesn't take much for the bacteria to wear it away. Versus a large breed dog, like say, for just example between the two, miniature poodle versus a German Shepherd. Miniature poodle, thin bone. German Shepherd, it's like a ½ inch wide. So you've got big difference between those bones. So if the bacteria eats the same amount of bone on a miniature poodle versus a German Shepherd is not a problem. Miniature poodle, we suddenly have no bone support on that tooth.
Because bacteria doesn't matter whether it's thicker bone or thinner bone.
Exactly.
Gotcha. All right, now here's actually one of my favorites. This is even on my paper. I've thought about this one for 2 days now. So, yeah, Ricky, I did it. I was waiting for it. I answered your guys' first. So when I had a young puppy, I always used what you have right there. Can you even show it to the camera? We have like a little finger brush kit. And I went to one of my vets, and I don't currently go to that vet anymore. She retired. But I always use the finger brush. And she told me that it does absolutely nothing for the teeth to actually break away plaque. that only the real toothbrush does. But I've always been curious about that. Is it good as like a training aid for teaching teeth brushing?
Absolutely.
Go into your example. I'm ready now.
And I even have the model to show you. So basically, we want to start establishing good habits when they're very young of getting them used to the toothbrushing. And the size of brush does also make a difference with the size of breed that you're working with. You know, if you're talking about a Yorkie, you're not going to get the big toothbrush in their mouth. It's just not going to happen.
Right.
Versus finger brush you can actually get in a Yorkie's mouth. So you start when they're very young. So basically when you first get the puppy, you want to make sure that you do have animal toothpaste. So
can you say that last part one more time? Because we have heard about regular toothpaste being used, and it is, from what I understand, very harmful.
Yes. Animal toothpaste, very important. Make sure it is labeled for dogs and cats. It is swallowable, so it's not going to harm them if they eat the entire tube, essentially.
Okay, good.
And it has enzymes in it. Those are the two specific differences between human toothpaste and animal toothpaste. So the enzymes alone can make a difference. And this is what I remind people, even if we don't get a good brushing in, if you get those enzymes in there on a regular basis, it helps.
Interesting.
So ideally, we brush every day. Just like with you and me, it makes a difference how often you brush.
Absolutely.
So ideally, we brush every day. You want to start with, when you're first getting them used to it, you just put a little bit of the toothpaste on your finger and let them lick it off first. Make sure they like the flavor. It does come in different flavors.
I was just about to ask, does it matter what flavor you use? Chicken, beef? Because I know a couple different brands offer different flavors.
They do. They offer different flavors. I always tell people it depends on what your pet likes, but also what you like. Because if you don't want your dog smelling like tuna, maybe don't use the tuna flavor.
Yeah, that's fair. That's fair. No puppy kisses after tuna breath. That's true.
So put a little on your finger, let them lick it off first so that they're used to the flavor. Once they're used to the flavor, you stick some on your finger and you just rub it on their teeth. So with dogs and cats, you don't have to get on the inside for the most part. Some of the brachycephalics, if you can occasionally get it on the inside, it helps. But the other breeds, you don't have to get it on the inside of the teeth, just on the outside of the teeth. So you put a little on your finger, you start with just rubbing it down the sides, inside their lips, getting it on the teeth. Then we move to the finger brush.
This is so exciting.
Well, it goes along with training. We're training them to accept their dental care.
I've had my dog for 12 years. I've brushed her teeth for at least 8 of those years, and I've never had anyone show me the full process. So like, this is a treat, guys. This is so special.
This is one of my passions. So you use the finger brush, you put a little bit of the toothpaste on the finger brush, and then once again, inside their lip, you just run it down the sides. Do the upper, do the lower, other side, upper, lower, and that's how you start getting them used to it. Once you've done that for a couple of weeks, typically, so this is a process, they will accept it at that point, and they're pretty used to that. If at any point during the process they're not accepting of it, you move back a step and you go back there.
Rubbing it with the finger, right?
The training,
We do this every day here, so we're going to benefit from this too.
And then, so once you've got them used to the finger brush, unless they're a teeny tiny little dog, you can move up to a dog toothbrush. You notice it has an angle to the heads. That's to help so that you don't have to like pry their lips all the way open. You just slide it on the inside of the lip.
And it moves the lip aside for you.
So you take it in there and it just slides right in.
Cool.
And you've got, most of them have 2 heads on them. Some of them are just the large one, but most of them have the small and the large. So that's obviously for different size animals. So you
I use that for like the little pibble teeth in the front.
So that's basically what you do. And like I said, if you start with puppies, they're very accepting of it. Getting an adult dog to accept it is a little bit harder.
I agree. I agree.
Takes a bit more work. But yeah, the puppies, if we get them used to it, makes a huge difference. And the longer we keep them with the healthy teeth, the better we are, and hopefully don't have to extract teeth as they get older.
Yeah, that's true.
I would love to put myself out of the
extraction business
of extracting all the teeth. Really, truly.
I know you already answered this once. I'm just going to ask it one more time. How often should they be brushing?
Daily, if possible.
Okay, so you can't hurt the gums if you overbrush or anything, like once a day is totally fine.
If you're being vigorous, yes, you can definitely hurt their gums. Just like with us, you want to make sure that you're not using, anything that's hard bristles. All the dog toothbrushes are soft bristles. So don't go getting the firm bristle, a normal human toothbrush. Yeah, don't do those. If you do the soft bristle ones, honestly, the human toothbrushes are fine. They're the soft bristle. But you want to make sure you're using soft bristles, and you want to make sure that you're not being vigorous with your brushing.
Okay. The only reason I'm asking you is I have an elderly dog. She's 12 years old. And I have learned that when I hold the brush near the head, her gums are more likely to bleed a bit. She's old. She does have perio something. It's a really long word that I can't remember. But when I hold the brush farther down by the little side and still use the big head, I feel like I can get enough of the teeth without her bleeding, and I can tell the discomfort is lower, and it feels like she wants me to do it more in that way. Is that because I'm applying less pressure and that's more of the proper use, or?
Yes. Okay. Less pressure is good. And like I said, the dog and cat toothpaste, it has the enzymes in it. Okay. The enzymes are what makes the difference. So you don't have to really go... You don't have to be vigorous.
You're not trying to break down plaque. You're trying to get it inside there. Gotcha. All right. I love it. That is all the questions I have. Okay. Do you want to take some live questions? Do you have anything else you want to show us?
Yeah, a couple more things just to talk about.
Please.
So this is obviously a normal looking mouth. So just to kind of point out the differences between this and the brachycephalics. So basically the brachycephalics, we have the same number of teeth. Dogs have 42 teeth, a lot more than us.
Yeah, a lot more than us.
In the brachycephalics, you have the same number of teeth, but squished into half the space.
So basically all those little gaps
all these little guys, there's no gaps, and a lot of them turn sideways. So that makes it extra challenging for brushing their teeth, and is also part of the reason that the brachycephalics were like,
wait, did you say they turn sideways?
Sideways, yes. Instead of these teeth being oriented this way, they will actually tilt sideways. So you see half the tooth, essentially.
Yeah. Are they born that way, or do they kind of like, as they grow, the teeth push together, or they're just born that way?
They're born that way.
Okay.
Yep. With our breeding to change the face shapes like that, it has changed where their teeth naturally erupt. Gotcha. So makes it especially important for them to maintain dental health. And I mean, I hate to say it, but I do see a lot of brachycephalic patients that as soon as I lift up their lips and look, I'm like, that's a bad tooth right there. That one's got to come out.
Young too? Young dogs?
Yes.
Ouch. Yes. Okay.
Yeah. So that's kind of that piece. And the other fun thing that I have is there is an organization called the VOHC, Veterinary Oral Health Council. Everything that gets approval on the Veterinary Oral Health Council has to go through third-party testing to show that it's effective for improving dental health in dogs. There's a cat portion to it, but yeah. So you go on their website, VOHC, everything they list.
That's so cool.
And it's broken down into categories. So there's chew toys, there's toothpaste, there's foods, everything that is shown to be effective in helping with dog oral health.
And they have tested this. This has been proven in a lab.
Yep, exactly.
That's cool. That's very cool.
I like that.
There's so many products out there, guys. I mean, we've done dog food product reviews and all that, and there's just so many different brands. No one even thinks about the teeth and how many products there are out there for it.
So many products.
So basically what you're saying is there are definitely products built better than others.
There really is.
Okay.
There are some products that I'm like, it might taste good, versus there's other products that we're like, we know that works.
Yeah. Okay. I got one more question.
Yes.
What about bully sticks? Because I know a lot of people who use bully sticks, but I've also heard from other veterinarians that it can push back the gum line if the bully stick is too big for the dog. What do you think about that?
So I personally think they're disgusting because I know where they come from, but that's just
my first experience with one was to pick it up like a stick and put it on my nose and smell it. So I'm with you. Google it. We're not saying it on live.
That's my personal stance on that. But
that's fair.
As far as how they do for dental health, basically, like with any dental chews or regular chews, you want to be careful with how the dog is using them. Okay. You know, if you see that they're being overly aggressive with their chewing of them and you're getting blood on the item that they're chewing, too much. Okay. It's not effective for them, not doing what we need it to. Okay. If you see that they're doing well with it, we're not having bleeding, we're not having any irritation of the gums, you're probably fine to use it. Okay. I have quite a few patients that they do chew on those, mostly to keep themselves busy. You know, as we know, you gotta keep a puppy busy.
You really do. You really do.
So they're useful for that, but as far as improving dental health, not really.
Okay. So it's more of a training aid for just keeping your puppy occupied. It's not really going to help with the teeth at all.
Correct.
All right. One puppy myth you got solved for me. I appreciate that. And how are we doing on time? Oh, we're doing excellent on time. I'm only over by 5 minutes.
We are over by 5 minutes.
I know. I said I'm doing great. I'm only over by 5 minutes. That's how impressed I am. I know we have a couple people that want to ask some questions. How do you want me to do this, Ricky? Do you want me to go up and read it? Okay, perfect. So we're going to go through a couple of these. Not on Instagram. So you guys are cutting out too much.
I don't know if they're vet related or dental.
And guys, if you guys want to ask a question, these are all dentistry vet related questions. Dental bones useful? I think we've said yes, they can be, but a very specific kind. And
yes.
We have a list.
If you go on the VOHC website, they will list which ones are actually effective.
Okay, I love that. I'll be checking that after. All right. Are CET Verbac dental treats good, or is there a better brand in her opinion? We brush daily too. I've seen that one. It's like the only bag that I look at, and I'm like, that looks like it was made by a vet, because the bag is a little bit more sterile and professional looking. Yeah. Yes. What do you think of those?
They work fantastic.
Do they? Okay,
they do.
Excellent.
And they are actually set for different sizes of dogs.
Nice.
The only thing you have to be careful with is they do soften as they chew on them. Mm-hmm. So you want to make sure that you don't have a dog that's a little bit of a softens them up and then swallows the whole thing all at once.
That was my next question.
Some pets that will do that. Mm-hmm. But beyond that, they're excellent because they do actually have the enzymes in there.
Are they like a piece of rawhide or like the no-hide rawhide? Like...
It's a rawhide, and it's impregnated with the enzymes. So the same as their toothpaste. You notice it's their toothpaste that I'm carrying around.
All right, I did not catch up on that, but yes, I do now.
But yeah, it also has the enzymes in there, so I do like their products a lot.
Okay. I love it. Well, I'm already 7 minutes over, so I'm pretty sure Ricky's giving me the Indian eyes. But I got a couple more things. So, one, thank you, Dr. Child. We appreciate you coming in. We appreciate everything. And is there anything you want to let our people know? Do you want to tell them about your practice, how to get a hold of you guys, where they can see you on any of your social media channels, and just how to get general information?
Yes. We are definitely mostly on Instagram. Okay. I do think that we're present a little bit on Facebook and I think maybe on TikTok. I'm clearly not the one that runs any of the social media stuff. Mm-hmm. Plaza Del Amo Animal Hospital is our name. And our phone number is 310-530-5511. We are happy to see puppy patients and any other new patients.
Kind of just brighten up your day, don't they?
It does. It really does. Yeah, we kind of carry them around and introduce them to everybody, and we do a lot of the getting them just used to things on the first couple of visits of here's tons of treats and let's just have a good time.
Can you say that one more time? That is a really, really important factor of taking your puppy to a new vet, is that's something not every veterinarian office does. Yeah. That is incredible.
Yeah, we love doing that. We have, I want to say, 5 different types of treats. So we definitely have a good variety depending on the individual, which one they like. And yeah, the puppies, they might have a little gastric upset after their first 2 visits, but we really load them up with the treats and make sure that they have
positive association. We love that.
Exactly.
That's training, guys. She's going to help you train your puppy. I love it. Awesome. All right, guys. Thanks again, and we'll see you guys for the next show. You guys have a wonderful day. Thanks for tuning into Ask a Puppy Trainer Show.
We hope you found some advice that you can use to help make puppyhood a little easier.
Don't forget to join us live every Wednesday at 1 p.m. Pacific time on Instagram or TikTok at The Puppy Academy.
This is where you can get a chance to ask your burning questions in real time. And if you want even more puppy guidance, visit our website at thepuppyacademy.com for info on joining our online puppy school.
If you enjoyed today's episode, please consider subscribing to our podcast and leaving us a review.
These reviews let more people find us and supports us on our mission to help as many puppy parents as possible around the globe.
Thanks for listening, and we'll see you in the next episode.